Welcome once again to this channel, and today we are going to look at angiotensin 2 receptor blockers and the antihypertensives. So let's look at the mechanism of action of the angiotensin 2 receptor blockers. So what they do is they antagonize angiotensin 2 receptor type 1 and thereby block vasoconstriction, sodium retention, which is an effect of the RAS. So as compared to earlier, we talked about the angiotensin converting enzyme inhibitor, where I asked and then formed that you should go and review my previous presentation on the RAS to give you a bit of enlightenment to this whole presentation so that you can appreciate it. So this can still be a reference where you go to check on the RAS to appreciate this whole presentation. So they block the receptor site where angiotensin 2 is supposed to bind to produce vasoconstriction and then leading to adrenal cortex where there should be reabsorption of sodium and water to increase blood volume and then increase blood pressure. So they block those sites. So even though angiotensin 2 will be potent to do its work, but it will get a receptor site to bind to make an effect. So what are the pharmacological effects of this class of drugs? So they aim to decrease blood pressure, which is our main goal, by the relaxation of blood vessels, decrease in blood volume, and oxygen demand of the heart. Some few generalized side effects include hyperkalemia, headache, and dizziness. So let's look at this diagrammic presentation to get a bit of in-depth understanding of what we are trying to explain earlier. So this angiotensin, this is released from the liver and this is renin from the kidney to start up the RAS mechanism. So what happens is that renin will have to react with angiotensin to form angiotensin 1, which is not a potent vasoconstrictor. It needs to be activated. So there is a release of angiotensin converting enzyme from the lungs. So at this point in time, if we are supposed to be looking at angiotensin converting enzyme inhibitors, this is where that drug will work, but we are looking at a blocker of angiotensin 2. So here, even though ACE is released by the lungs, converting the angiotensin 1 into a potent one, which is angiotensin 2, which is supposed to do the work of vasoconstriction and then retention of sodium and water to increase blood pressure. This will be produced, but a blocker of this drug class will go in to AT1 receptor where this angiotensin 2 is supposed to bind and cause vasoconstriction as well as sodium retention and water. So at this point, though angiotensin 2 is potent enough to get the job done, but when it gets there, the receptor site is blocked, so it can't actually fix in there and elicit the response it's supposed to do to increase blood pressure. So the drug simply cuts off that supply, meaning at this point in time, instead of this drug causing vasoconstriction, there will be vasodilation, because at this point in time it won't get an effect on the blood vessels. As well as if this drug is supposed to go and then stimulate the release of aldosterone to cause sodium retention and water retention, it won't be that way. So at this point in time, we are achieving our vasodilation to decrease blood pressure as well as sodium retention and then water retention as well to increase blood volume, leading to increased blood pressure will not be there. The receptor site is blocked. Let's look at some uses of this class of medication. Hypertension, which is our main focus. Then we have heart failure, then diabetic neuropathy. You have hypertension, heart failure, and diabetic nephropathy. Examples of this drug include the statins. So you can see we have losartan, valsartan. So usually this class of drug ends with the statins. That's the angiotensin 2 receptor blockers. But the angiotensin converting enzyme inhibitors end with pro. So we have lisinopril for those ones. But for the blockers, they have sartan at the end. So you have losartan, valsartan, etc. Alright, thank you for your time, and then we'll call it a day on this presentation. Next time we'll continue with other classes of antihypertensive drugs.